right now we're talking about all the flooding, types of possible injuries that can happen when it comes to flooding right now in the hill country.
Right, so there's the initial hazards of the flooding, which are related to trauma or electrocution or drowning, of course, but there are hazards that will occur over the next week to 2 weeks, as long as they're standing water, and those hazards are also pretty significant, and they would affect the rescue workers and people doing cleanup.
Okay, so with the initial flooding, right, we have people who have been rescued, they've been found in trees, and I even spoke to someone who initially he stood on the meter box for his home and waited to have the water recede. So what types of injuries could people possibly expect when being in those floodwaters?
So the standing water is what's dangerous, and it contains a lot of bacteria from the runoff from the land, and that runoff contains a lot of the animal feces and waste from farms and just animals that are wild animals, and so that bacteria gets into the water, and it can cause unusual infections. So one of the more common injuries that we see after a flood disaster is like lacerations or puncture wounds on the lower extremity, because people are walking through the water and they can't see what's underneath it, so they may step on a board that has a nail in it, or be scraped by metal or something underneath the water. And that water that contains these other bacteria, different from normal infections. If you get an infection, normally it's staph or strep bacteria, and doctors usually use antibiotics targeted towards those, but standing water has a lot of this other bacteria in it that's called Aeromonas, and it's not, the same antibiotics are not effective against it. So it's really important to let your doctor know if you've been working in standing flood water, so that they can then consider these other antibiotics.
Awesome. With that being said, for people who are out there rescuing, for the people who have been through this traumatic event and they've been rescued, or perhaps, like I said, I spoke to a young man yesterday, and he was able to thankfully survive that event. And right now he's going through his home and picking up and cleaning. Is there anything that he should probably be worried about in the sense of, he doesn't, for people who maybe don't see immediate injuries or an immediate danger, what can you speak to that about?
Well, so these infections that come from skin lacerations, just from working in that environment, and especially if you have a home that's been partially destroyed, those infections don't occur until 3 to 5 days later. It's not that you get an infection immediately with a laceration. It seeds with the bacteria, and then it occurs over the next 3 to 5 days. So it's really important to make sure that you're wearing protective gear. So that would be like waders or waterproof boots if you're going to be in the standing water. And if you get any type of laceration or injury, clean it really well to begin with and cover it, and then don't get it wet in the water. It's also important to wear gloves, if you're rummaging through some of the debris. And another thing is making sure that your tetanus shot is up to date, because tetanus lives in the feces of animals, and that will get washed in as well. And Texas has one of the highest rates of tetanus in the country. It's a rare disease, but it's potentially fatal.
When you talk about having gloves and having waders and protection gear, I mean, these people have lost everything. It could probably be hard for them to get those supplies right now. What can they do in the event that they don't have those things, and they're still, doing their best to just get through this difficult time?
Yeah, well, the best advice is to use protective gear, but obviously if you get any injuries, pay attention to your surroundings. Look for any type of anything that would injure you, sharp instruments or boards with nails in them, and just to be careful, and then report any injuries or lacerations right away.
Okay, and then we're talking about sepsis. What are the signs for those types of infections? What can people look out for if we are in day 3 right now? So some of those infection signs should be setting in right now, right?
Well, so there are some infections that you can get, like gastrointestinal infections and pulmonary infections from either inhaling or ingesting the standing water. But sepsis is just the body's systems being overwhelmed by an infection, whether that's a skin and soft tissue infection or a gastrointestinal infection. That occurs usually several days later, and it's if you can treat the infection earlier, then you're not going to get sepsis.
Mm-hmm. And I mean, with
there'll be signs of an infection before there's sepsis.
Okay.
You don't just start out with sepsis.
No. With that, what are like some signs people can kind of like tell immediately, like, hey, I have an infection, right? I mean, I know it could probably be obvious, but just for people who may be unaware.
Yeah, so the common signs and symptoms of an infection most commonly would be a fever. If you're having a systemic infection, you're gonna get an increase in body temperature. You'll have malaise or this feeling of just weakness or general, unwellness. If it's from a wound, the wound will have local signs around it, like redness or pus that's coming out of the wound. So all of those are concerning signs that indicate that you need treatment.
Okay. Are there any things that could maybe be not as obvious for people? Just asking. Just something
no,
that
I mean
maybe.
those are the signs of
Mm-hmm.
infection that we see. It's really that's what it is. Yeah.
Okay. All right. So we talked about types of injuries people can receive, right? Is there anything with that you want to make sure that people are aware of? I know we were talking about different types of debris that could be in the water that people are maybe wading through, cleaning up and stuff like that. Was there anything else on that topic that you want to go over?
Yeah, obviously puncture wounds and lacerations are the most common injuries that we see afterwards from standing water. Again, because it's obscure and you can't see what's underneath the water. It's usually dirty, and so those are the major concerns with walking around in some of the standing water. Obviously, don't enter any water that's rushing or an active stage of flooding, because that's another danger. And I would say if you're working in an environment for any length of time that has standing water, you need to make sure to wear mosquito repellent, because mosquitoes, several diseases that are mosquito-borne that are endemic to Texas, like Zika and West Nile virus, also dengue a little bit. So it's important to wear mosquito repellent.
Awesome. I know we were talking about the types of bacteria that can be found in the water. We were talking about how the animal waste and as well as the sewage waste that are being washed away with these homes and such. Was there any other types of bacteria people can probably look out for while out there right now?
Well, initially it's going to be related to bacteria. Later on, maybe months later, there are problems with mold that can cause respiratory infections and even some soft tissue infections. But initially, it's going to be related to bacteria.
Okay. And with that being said, you talked about the symptoms, how long it typically takes for them to appear. We went over sepsis and the dangers of that. I mean, if someone has sepsis and is noticing it now that it's kind of setting in, what do they do? What are their steps? Who do they call?
Yeah, so I would first say that it's of particular, you should be particularly cautious if you have diabetes. So diabetes is we have a high prevalence here in South Texas, and people with diabetes have a blunted response to infection. So they may not have the same signs and symptoms that other people do to an infection. But the first thing is, any of the first signs of infection before you get sepsis, that's when you need to get treated. People that get sepsis are really critical, and they have to get to the hospital right away. And those are people that will start to develop a high fever, a low blood pressure. They'll feel weak and dizzy, and those are the major signs you need to get to the hospital right away.
Awesome. With those other small injuries, people might think that they're minor, but it's still really important to get those taken care of, right?
Yeah, especially puncture wounds. So puncture wounds are wounds that are different than a laceration. A laceration is like a cut, A puncture wound is more like a penetrating injury, and it can seed bacteria deep inside, whether it's the foot or the leg. And so that if it can't drain out, then it's going to form sometimes an abscess and then cause a more serious infection. So puncture wounds are particularly dangerous.
I mean, people are out there, they're getting things done, they're trying to clean up. For people who maybe are not having access to a doctor easily, what can they do? What are some things? Should they, go to further into the city, like Kerrville and seek help, or those people who are in Hunt and Ingram who are cleaning up? What can they do?
Well, the first and most important thing is if you get an injury, make sure it's clean and you cover it with a bandage, and then don't get it in the water again. And then if you do start to develop signs of a local infection, I would notify the first responders that are on scene, and they can help get you some medical treatment.
Awesome. Is there anything that I'm forgetting that we haven't talked about dealing with these types of injuries that people can be receiving while they are out there cleaning up the damage from this flood water?
No, I think that's it, yeah.
All right. Anything else you want to mention?
No. I would say, here at UT Health, we're happy to help people in need, and we have a clinic that runs here at the Medical Arts and Research Center, both in the podiatry clinic, but also infectious diseases. And if you have any signs or symptoms, reach out to the clinic, and we're happy to get you scheduled as soon as possible.
Awesome. We were talking about the things that people need while they're out there. Are those things that some people could probably donate?
Yeah.
There's a lot of donations going on, and I know that a lot of people don't always know what to donate. So what are some things that could probably help prevent infections that people can donate?
Right, yeah, so I think some rubber boots, waders, and gloves are really important for people that are engaged in a cleanup effort afterwards. So those would be valuable donations to those involved.
First aid kits as well, probably?
First aid kits, yes. Yeah.
What are some of the most important things from those first aid kits outside of bandages?
Yeah, well, antiseptics and bandages, those are going to be the initial treatment for wounds. And if you need an antibiotic, obviously you're going to have to go see a provider to get an antibiotic. But certainly in the first aid kit, definitely antiseptic and bandages.